Hey guys, it's Dr. April Lynch coming to you from Bluegrass Veterinary Hospital in Gallatin, Tennessee. Today I want to talk to you guys about an outbreak we've been seeing of respiratory illness in our patients. And what we're talking about is known as canine infectious respiratory disease complex. That's a big word. It basically is referring to what is more generally known as kennel cough. However, we are seeing outbreaks of this infection, and during those outbreaks, we're seeing some unusual symptoms and unusual presentations of kennel cough that are concerning that we need to discuss and get you guys to be aware of. So let's just start at the basics. What is kennel cough? And it is basically just an infection that your pet will get from another pet caused by a number of different agents. In fact, there are probably 9 to 10 different agents. Some are viruses and some are bacteria that can cause this syndrome. It's highly contagious, usually picked up when they are boarding at a kennel, at a dog park, a dog show, and that type of situation. And usually it just causes a self-limiting, persistent, dry cough, which is very annoying for the pet and extremely annoying for the owner, which is typically why they bring them into us. So again, usually kennel cough is a dry, persistent cough, very contagious, that dogs get after being exposed to other dogs. And the hallmark of this infection is just a self-limiting, the dog is coughing, the dog's kind of annoyed by the cough, may not feel well, may run a low-grade fever, they may not want to eat, and the coughing may be so severe that they may gag or retch, and then the owner gets concerned about that. But usually these dogs are overall healthy, and it oftentimes will resolve within about a week with or without treatment. However, during an outbreak of these infections, regardless of the cause, what we see is an increase in the number of cases that we would normally see of kennel cough, an increase in the severity of the symptoms. So some of these animals come in and they really don't feel well. They may run a high-grade fever, they may not want to eat at all. And also a longer duration of illness. Rather than just about a week of symptoms, some of these dogs are progressing to having 1 or 2 weeks of illness, not feeling well, and it can progress to pneumonia or even a respiratory distress syndrome. So what to watch for during an outbreak for anything concerning would be longer duration of symptoms. So beyond a week, your dog is still coughing. Your dog is running a high-grade fever. You may notice discharge from the eyes and nose. Your dog may not want to eat. And then if it progresses to pneumonia, what you may see is labored breathing. Your dog is laying around, has no energy, may run a very high fever, may not want to eat. You're noticing that they're having difficulty breathing, taking deep labored breaths, and sometimes we may notice that the mucous membranes, such as the gums, instead of looking pink, are looking blue or gray, indicating a lack of oxygen. So cough suppressants are the mainstay of our therapy, generally for kennel cough, because it's just an annoying cough. However, dogs with the more severe respiratory disease complex or the respiratory syndrome may require hospitalization, fluids, antibiotics, and x-rays, oftentimes even help breathing, oxygen chambers, and very extensive overnight care. And unfortunately, what many veterinarians have seen, and it has been our experience as well during an outbreak, is some of these dogs who are sick with pneumonia or even just the usual kennel cough symptoms can rapidly progress into the respiratory syndrome and even die without any warning or without even a chance for us to treat them, which is why we are making this message. Our recommendations at Bluegrass Veterinary Hospital for our clients regarding this syndrome would be the old saying, an ounce of prevention is worth a pound of cure, is definitely applicable here. For most of these infectious agents, we have tried and true vaccinations that are safe, healthy, and effective. So let's definitely push the vaccines. I oftentimes hear clients say, I don't need to get that vaccination because my dog doesn't go anywhere. We don't need to get the Bordetella vaccine. He doesn't get boarded. Well, I will say to you, if your pet is at the veterinary hospital, he is exposed to other dogs. If your pet goes on a walk around the neighborhood, he is exposed to other dogs. There are just very few dogs that have the lifestyle where they're not around other dogs. Dogs are pack animals. They want to be with other dogs. We recommend core vaccines here at Bluegrass Veterinary Hospital, and one of those is the distemper, parvo, and para-influenza vaccine, which you may know as DAP, DAPC. That contains several components to vaccinate and protect our pets against several of these agents that cause this syndrome. So annually, most pets are getting vaccinated for this, and that's really important. The kennel cough vaccine, which specifically vaccinates for the bacterium called Bordetella, which is one of the agents that we see in this complex. That's oftentimes the one that you will see your pet gets a little squirt in the nose or in the mouth. And I will say that even if your pet does not get boarded, does not get groomed, kenneled, all that, I would highly recommend that you get this vaccine for the reasons that we are talking about here, for prevention against this highly contagious agent. And in fact, a lot of the grooming and boarding facilities in this area and elsewhere are now requiring not just an annual, but a semi-annual vaccine with Bordetella every 6 months. And we are now recommending that for our high-risk patients, just to really prevent, because it is a shorter acting vaccine than most of our annual vaccines. What to do if your pet is showing symptoms of kennel cough or something more severe? Definitely call us, call your provider, and discuss your concerns with them. More than likely, we are going to recommend that your pet be seen. We can't really diagnose or treat over the phone. However, it's important to note, when you make your appointment, make sure that you tell the person who's making the appointment for you that your pet has symptoms of kennel cough potentially, because we have a very strict protocol for these types of situations where we may have your pet come in the side door instead of the lobby to reduce your pet being exposed to other animals and perpetuating this illness. We may put you into the same room where we will see other animals with the same symptoms during an outbreak, and then we have designated staff that see those pets throughout the day and nobody else interacts with those sick animals. We wear hazmat suits, we have foot washing stations, we take it pretty seriously because we don't want to spread infection to other pets that are coming in that are healthy, that don't have these symptoms, or to our own pets at home. We would recommend that you use great precaution, if not just try to avoid exposure to other dogs, especially dogs that your pet is not familiar with, dogs that you may not know whether they're healthy or whether they're vaccinated. So going to the dog park, to the boarding facility, to the grooming facility, or to PetSmart would not be recommended if your pet is not fully vaccinated, if your pet has other health concerns, or during a time of an outbreak. So I hope that this has been helpful for you. If you have a question or a comment, please leave it in the comment section below. If you haven't already, subscribe to our channel and like this video so that you can catch our upcoming content, because it's going to be good. See y'all later.